Good morning, everyone. Welcome to the February 19th episode of the FCAAP Vidcast, your source for news and updates on the world of pediatrics here in Florida. I'm John Horn, Publications and Advertising Coordinator here at FCAAP. Grab a coffee and let's start the day. The 59th Annual Pediatric Postgraduate Course is coming up next month in Coral Gables, and we're joined this morning by a special guest who's going to tell us all about it, Dr. Rani Gereige. Good morning.
Good morning. Thank you for having me.
Tell us a little bit about this Pediatric Postgraduate Course.
Absolutely. The 59th Annual Pediatric Postgraduate Course is actually one of the longest standing CME course that is geared toward general pediatricians. This is our 59th year. Obviously, it predated me working here at the hospital at Nicholas Children's. It is a program that spans over 3 days. And it is designed to be a blend of both practical information for the general pediatricians, hot topics updates from local and national speakers, and hands-on workshops as well to allow the attendees to try their hands at doing stuff related to the procedures in the office or gadgets and gizmos in the office or other things that they could use when they take back to their practice.
And how are you involved in planning the event?
So in my role at the Nicholas Children's Hospital, I serve as the Executive Director of Medical Education, and I am the CME chair for all the CME programs at Nicholas Children's. But I have served, even though different courses have different chairs within our umbrella hospital, I have served as the chair of this course for the past 13 years since I've been here at the hospital. This is my 14th year. We usually design this course, not just me. I want to give credit to our scientific planning committee. We get a lot of feedback from our former attendees who come every year. We also look up at what's coming up down the pikes from AAP guidelines to policy statements to anything new that a pediatrician really needs to know. We try to kind of include into this course, and our scientific planning committee is a hybrid of both hospital-based physicians, general pediatricians, subspecialists, and also community pediatricians, including residents and chief residents as well.
Now, I know the chapter is going to have a booth. We're going to be exhibiting there. What is a key reason that pediatricians should attend?
Yes, we are excited to have the chapter exhibiting at the course this year, and to welcome you guys to Miami in March. This year, I think there are several reasons where really pediatricians would want to come, other than being in a warm environment in Miami in the middle of Coral Gables will be really nice. But also, we have sessions that are geared toward the primary care physicians, especially related to topics that are currently of need for the pediatricians. A lot of mental health sessions related to screening and treating mental health disease or disorders in children. We do have also several sessions that have to do with the opioid epidemic that will meet also the MATE Act, the DEA MATE Act for the 8 hours. So we have 6 hours embedded into the sessions, into the program that will meet the MATE Act from the DEA for the pediatricians who need to complete that. But they're geared toward children. So we have sessions related to how to do pain management without using opioids. And then we do have some, and always Sunday is always geared toward infectious diseases. And we know that infectious diseases is one of the bread and butter pediatric disorders for primary care physicians. So we always reserve the Sunday, the last day for the primary care physicians for a track almost or sessions on infectious diseases. So this year we do have an expert in tropical diseases, since we are now seeing a lot of tropical diseases coming our way here, especially in South Florida and in Florida with the climate change and the warm up of the environment. I think some of the areas in the United States are seeing some what normally would have been a tropical disease. Plus, with the travel of people, there's a lot of influx of some of those diseases appearing here in our clinics. Um, the afternoon workshops are going to be great because we do have dermatology, we do have gadgets and gizmos, we do have how to bill and collect for complex patients, taking care of the complex patients in your office. We know that those patients take a lot of time. And then we have also a session done by a parent where we have a parent who's talking about partnering with families and really doing a patient-centered approach for patient care. Um, and the other reason to come is to network and see your friends and make new friends. And we do have an opening reception on Friday night, and hopefully it will start would kick us off into the course. And like I said, we do have usually a some percentage of attendees who are international as well, so that would be good for them to network with our own Florida pediatricians as well, and having our exhibitors there talking to them as well.
Sounds like it's going to be a great event. That is March 22nd, 23rd, and 24th in Coral Gables. Dr. Rani Gereige, thank you so much for joining us.
Thank you so much. Thank you for having me, and looking forward to seeing you in March in Miami.
And that's going to wrap up for this episode of the FCAAP Vidcast. From all of us here at the chapter, thanks for watching. Go have a great week.